Hi, I'm Neel Shetty, part of Group 19, along with Tess, Oswalt, and Natalie Gutierrez. For our project, we chose chronic obstructive pulmonary disease, commonly known as COPD. COPD is a group of respiratory illnesses that includes emphysema, which damages the air sacs in our lungs, and bronchitis, which is an illness that damages our airways. The overarching disease is characterized by symptoms such as coughing, shortness of breath, and excess phlegm. These symptoms are usually present and will worsen over time if not addressed by doctors, medications, and/or prevention techniques. COPD is a chronic disease that is not treatable, and it has quickly become a leading cause of mortality and years lost to disability in the United States, meaning that with 300 million people affected worldwide, there are about 64 million disability-adjusted life years. Since COPD affects the respiratory system, serious risk factors include air pollution, smoking, genetic predispositions, and a history of asthma. In 2020, individuals who smoked had a 13% prevalence of COPD, while individuals who never smoked had a prevalence of 1.8%. Overall, smoking is linked to 90% of COPD deaths in the United States, and while it is the main cause for the high mortality rates linked to COPD, other factors such as air pollution and genetic conditions can also lead to the development of COPD. COPD progresses with age, so the incidence is much higher in populations above the age of 40. Looking at health disparities, there is a higher prevalence of COPD among non-Hispanic white adults than among African American and Mexican American adults. Additionally, in the United States, COPD is more prevalent in the southeast region and is 2 times higher in rural areas than in urban areas. COPD does not currently have a cure, making early diagnosis and treatment imperative in slowing its progression and reducing the number of flare-ups. Prevention strategies include quitting smoking, increasing physical activity, and getting vaccinated. 2 of the main plans in place are those proposed by the World Health Organization and the National Institute of Health. The WHO, a global organization, has a plan that works specifically with each nation on their own federal level in order to promote the highest level of health possible. Their action plan includes a package of Essential Non-Communicable Disease Intervention, or PEN, which was designed to strengthen non-communicable disease management in areas with less access to healthcare. Another aspect of their plan is to create a global alliance against chronic respiratory diseases, or GARD, whose mission is for people to be able to live in a world where they can breathe freely. In addition, the National Institute of Health has created its own 5-step action plan working on the federal level to increase awareness and facilitate earlier detection and treatment of COPD. There are also interventions put in place on a local level to prevent worsening air quality and, in particular, secondhand smoke. This can be seen in the changes that have occurred over the past 20 to 30 years, specifically looking at policies made to combat public smoking. Unfortunately, there is no conventional screening process, and many that have COPD do not realize that they do until serious symptoms arise. With little screening available and no real cure, treatment options range from additional prevention techniques such as quitting smoking to severe responses like lung surgery and transplants. Other ways to treat COPD include medications like bronchodilators and inhaled steroids, depending on the severity of the symptoms. Other options like pulmonary rehabilitation can be used to improve quality of life and learn breathing techniques, as well as oxygen therapy in which people can receive supplemental oxygen. The measures that have been taken up until now are working towards improving the quality of life for those with COPD and lowering mortality rates, but they are lacking in efficiency. Plans have been implemented, but the impact has made little progress in alleviating the overall problem of COPD. Looking at the Healthy People 2020 goals of lowering COPD deaths, they propose a decrease to 102.6 deaths in 2020. It is clear that we are moving in the wrong direction, with the rates increasing over time to 113.9 deaths due to COPD in 2017. The major gaps in research on COPD are a lack of long-term treatment options, awareness, and screening. Something that should be done to combat these is to increase awareness of COPD and create a more widespread screening program. By increasing the number of people screened, individuals can get the treatment they need before severe symptoms arise. Information about COPD is readily available to the public and can be found through a variety of credible internet sources such as the CDC and the American Lung Association. In addition, individuals concerned about COPD or showing symptoms can consult their physicians and seek care from their medical provider if necessary. There are several common misconceptions when it comes to COPD. One is that only smokers can get COPD, when in reality 24% of individuals that have COPD never smoked a cigarette. Such misconceptions are often rooted in misinformation about smoking, so public health officials should make it their mission to educate the population about the risks of bad air quality and smoking on our respiratory systems, especially for those with genetic vulnerabilities. Public health officials should also reduce use of tobacco products, especially targeting those who use e-cigarettes, since they tend to get people addicted to smoking at an earlier age and create a huge at-risk population for COPD. By reducing the numbers of those who smoke and increasing education on what is harmful, health professionals and healthcare systems can hopefully reduce their numbers of mortality rates of those with COPD. In this last image, we have our references and our sources that we used. Thank you for your time.